Have you ever wondered if the foods you're eating for better health could actually be harming your kidneys? It's a question that often goes unasked, but the answer might just surprise you. According to recent studies by leading medical institutions, with their added sugar, added salt, and added fats, these 5 foods considered healthy can literally kill your kidneys. The numbers don't lie. These findings have sent shockwaves through the health community. Are you eating them? Do you know what they are? The good news is that if you stop eating these supposedly healthy foods, you can lower your creatinine and start to support your kidney health right now. By the end of this video, you'll not only be informed but empowered to make healthier choices for your kidneys. We'll uncover the hidden risks lurking in your kitchen and arm you with the knowledge you need to protect your kidney health. Imagine feeling confident in your food choices, knowing that each bite supports, rather than harms, your body's vital organs. Join us on this journey to discover the truth about foods that could be sabotaging your kidney health. So you don't miss out on our upcoming tips to keep your kidneys thriving. Your kidneys will thank you for it. 1. Fruit juice. Fruit juice, often marketed as a healthful choice, can pose significant risks to kidney health. Despite its reputation for being natural and nutritious, excessive consumption of fruit juice can lead to detrimental effects on the kidneys. Why is fruit juice considered healthy? While fruit juice contains vitamins and minerals, what are the hidden dangers it presents to kidney function? Fruit juices have been associated with an increased risk of heart disease and diabetes. If you're drinking a cup, or 250 milliliters of fruit juice, you're ingesting up to 30 grams or 8 teaspoons of sugar. Excessive sugar and fructose consumption, common in fruit juice, can contribute to kidney damage and disease. An insulin spike can damage the tiny blood vessels inside the kidneys. An insulin spike destroys the filtering units of the kidneys, the nephrons, and causes serious kidney damage. In fact, diabetes is the #1 cause of kidney disease because of this process. Additionally, high levels of oxalate found in certain fruits can increase the risk of kidney stones. The high sugar content in fruit juice can lead to insulin resistance, promoting inflammation and oxidative stress in the kidneys. Furthermore, excessive fructose metabolism burdens the liver, leading to uric acid production and kidney damage. Another study in the American Journal of Clinical Nutrition, 2022, revealed a correlation between high fruit juice intake and increased levels of uric acid, a risk factor for kidney damage. The liquid calories contained in fruit juices, and in other sugary drinks like sodas and alcoholic beverages, are actually known to cause even more troubles. Bottom line, even if they used to be perceived as healthy, it is better to avoid fruit juices and other sugar-sweetened beverage if we care about our kidney health. 2. Diet sodas. Now, you may think that if you remove the sugar you remove the problem, right? Well, no. These diet drinks are actually sugar-free, and are artificially sweetened with aspartame or saccharin or other synthetic sweeteners. Diet sodas, often perceived as a healthier alternative to regular sodas due to their lack of sugar and calories, can actually pose significant risks to kidney health. Despite their popularity among those seeking low-calorie options, diet sodas are full of tooth-eroding additives, possibly carcinogenic food colorings and artificial sweeteners that are proven to cause risk of stroke, heart disease, type 2 diabetes, and kidney disease. The artificial sweeteners, preservatives, and colorings in diet sodas can disrupt kidney function by overloading the kidneys with toxins and affecting their filtration capacity. Recent research has highlighted the detrimental effects of diet sodas on kidney health. Studies published in reputable journals such as the Journal of the American Society of Nephrology, 2022, have linked the consumption of artificial sweeteners found in diet sodas to an increased risk of kidney damage and decline in renal function. Moreover, the high levels of phosphoric acid present in diet sodas have been associated with the formation of kidney stones and renal complications. So this means that if you drink diet sodas regularly, your kidneys are going to be damaged. All the test subjects who drank diet sodas got some kidney damage. Nobody got out clean. This is actually pretty scary, if you ask me. These beverages, marketed as healthy, are actually doing more damage to our health than their already unhealthy sugary counterparts. So, if the risk of death caused by the tooth-eroding additives and the possibly carcinogenic food colorings present in diet sodas wasn't enough, there's even proof that diet sodas are killing the kidney health of people now. What to do, then? Avoid artificially sweetened sodas and never look back. In fact, you don't actually need anything besides plain water if you want to keep your kidneys healthy. You shouldn't drink any calories at all. So no soft drinks, no fruit juices, no diet colas. But, if you absolutely can't resist some sweetness in what you drink, make yourself a smoothie. Drinking real fruit pureed raw is a lot healthier than drinking fruit juices or diet sodas. 3. Salads. Why are salads commonly regarded as a nutritious meal option? What are the potential drawbacks of consuming salads for kidney health? Yes, eating salad is a healthy way to improve kidney function naturally, but you may be undoing all the benefits if you dress it too much. A study published in the Journal of the American Society of Nephrology, 2023. Recent studies have illuminated the adverse effects of high sodium content in salads on kidney health. Ingredients such as processed meats, cheese, croutons, and salad dressings often contain excessive amounts of salt, which can contribute to hypertension and kidney damage over time. Additionally, certain vegetables like spinach and kale, when consumed in large quantities, can elevate oxalate levels, increasing the risk of kidney stones. The high sodium content in salads can lead to elevated blood pressure and strain on the kidneys, impairing their ability to properly filter waste from the body. Excessive oxalate intake from certain vegetables can contribute to the formation of kidney stones, causing pain and potentially obstructing urinary flow. To protect kidney health, consider evaluating and adjusting your salad ingredients to align with renal-friendly dietary guidelines. 4. Foods rich in potassium. Potassium, often hailed as an essential mineral for overall health, can actually pose risks to kidney health when consumed in excess. Despite its importance in various bodily functions, an imbalance of potassium levels can lead to detrimental effects on renal function. Understanding the significance and potential consequences of excessive potassium consumption is crucial. It affects not only kidney health but also overall well-being. Studies published in reputable journals such as the Journal of the American Society of Nephrology, 2023, have demonstrated a link between elevated dietary potassium intake and an increased risk of hyperkalemia, a condition characterized by abnormally high potassium levels in the blood. Additionally, individuals with impaired kidney function are particularly susceptible to potassium buildup, as their kidneys may struggle to regulate potassium levels effectively. The kidneys play a crucial role in maintaining potassium balance in the body by excreting excess potassium through urine. However, when kidney function is compromised, potassium levels can become elevated, leading to hyperkalemia. This can result in symptoms ranging from mild muscle weakness to life-threatening cardiac arrhythmias. So avoid fruits like bananas, oranges, cantaloupe, honeydew, apricots, grapefruit, prunes, raisins, and vegetables like potatoes, spinach, broccoli, canned tomatoes, canned beans. The kidneys of an healthy person are always able to remove the excess of potassium from the blood. But, for a kidney patient, the symptoms of too much potassium can be as severe as a heart attack. So avoid potassium-rich fruits and vegetables. Also avoid canned and packaged foods in general if you need to keep potassium levels down. They are full of potassium and sodium, and the FDA doesn't even require food producers to label potassium levels. So be careful. 5. Energy bars. But are energy bars actually healthy? And are they suitable for a kidney-friendly diet? Energy bars, often marketed as convenient and nutritious snacks, can potentially have negative effects on kidney health. Despite their popularity among active individuals and those seeking quick energy boosts, certain components of energy bars can pose risks to renal function. In fact, a medium-sized energy bar will pack about 200 calories. So there's nothing special about the energy contained in energy bars. There's nothing magical about them, and they won't give you a boost in focus or strength. Some energy bars are so full of sugar they should be considered candy bars. Recent studies have shed light on the adverse effects of high-protein diets, often associated with energy bars, on kidney health. Excessive protein intake can burden the kidneys by increasing the workload of filtering waste products, leading to potential kidney damage over time. Additionally, many energy bars contain additives and preservatives that can further strain renal function. The kidneys play a vital role in regulating protein metabolism and excreting waste products generated from protein breakdown. However, consuming excessive amounts of protein, especially from sources like energy bars, can overwhelm the kidneys and impair their ability to function optimally. 9 foods to avoid for kidney health. Hello everyone. Today, we have a vital topic to discuss, one that concerns the health of our kidneys. So, if you've ever wondered how your diet affects those essential bean-shaped organs in your body, you're in the right place. We often hear about foods that impact our heart, liver, and stomach, but it's time to shine a spotlight on our kidneys. These remarkable organs silently work day in and day out, but they're not invincible. Poor dietary choices can wreak havoc on them, and today, we're here to shed light on this critical issue. Did you know that nearly 30 million people in the United States alone suffer from chronic kidney disease? That's a staggering number, and it highlights the urgency of taking care of our kidney health. Your kidneys are responsible for filtering your blood, removing waste, regulating minerals, and maintaining fluid balance. When they're compromised, it can lead to a host of health issues. So, the big question is, what are the foods that can be destructive to your already unhealthy kidneys? Well, that's what we're going to explore today. We've carefully selected 9 foods that you should avoid to protect your kidney health. These 9 culprits are not just your ordinary items in the kitchen. They are sneaky, often hiding in plain sight, and can exacerbate kidney problems if consumed excessively. We'll be discussing each one in detail, so make sure you stay tuned to find out if any of your favorites made the list. But wait, there's more. Alongside each food item, we'll also provide some kidney-friendly alternatives, so you don't have to sacrifice taste for health. We're all about empowering you with the knowledge to make better choices for your well-being. Remember, knowledge is power, and by the end of this video, you'll be armed with the information you need to keep your kidneys healthy. Let's get started. 1. Avocado. Avocado, while hailed for its myriad health benefits, does require special consideration for individuals dealing with kidney issues. This creamy fruit, rich in monounsaturated fats and a wealth of nutrients, can pose challenges for those with compromised kidney function. The primary concern with avocados lies in their potassium content. For someone with healthy kidneys, the body efficiently regulates and excretes excess potassium. However, in individuals with kidney disease, this process can be impaired. Elevated levels of potassium in the blood, known as hyperkalemia, can have serious consequences, including heart rhythm abnormalities. A standard avocado contains approximately 700 milligrams of potassium, which is a significant portion of the recommended daily intake for individuals with kidney concerns. This is why it's advised to exercise caution when incorporating avocados into your diet if you're navigating kidney issues. That said, it's not necessarily a matter of completely eliminating avocados from your diet. Instead, moderation and portion control are key. One approach is to enjoy only a quarter of an avocado at a time, which significantly reduces the potassium load while still allowing you to benefit from its valuable nutrients. 2. Bananas. Bananas are renowned for their rich potassium content. In fact, a single banana contains approximately 422 milligrams of potassium. While this is generally considered healthy for those with normal kidney function, for individuals with chronic kidney disease, it presents a challenge. The kidneys play a crucial role in regulating potassium levels in the body. When kidney function is compromised, as is the case in chronic kidney disease, the body's ability to excrete excess potassium is diminished. This can lead to an accumulation of potassium in the blood, a condition known as hyperkalemia. Due to their low calorie count and delightful flavor, people often consume multiple bananas at once. However, for those managing kidney disease, adhering to a daily potassium range of 1,500 to 2,700 milligrams is vital. Consuming just one banana can account for a significant portion of this recommended daily intake, ranging from 15 to 28%. If bananas have been a staple in your diet, but you've been advised to limit potassium, finding suitable alternatives may become a priority. While a wide array of other tropical fruits share the same high potassium characteristic, there are options that are more kidney-friendly. Enter pineapples, a standout choice in the realm of tropical fruits. Compared to their potassium-rich counterparts, pineapples offer a substantially lower potassium content. This makes them an excellent option for individuals with kidney disease seeking to strike a balance between taste and kidney health. 3. Tomatoes. Tomatoes, with their vibrant color and robust flavor, are a versatile ingredient that enhances various dishes. Whether consumed fresh in salads, slow-cooked in stews, or transformed into a luscious sauce, tomatoes have earned their place in the kitchen. However, the concern arises from their high potassium content. To put this into perspective, just 1 cup of tomato sauce can contain as much as 728 milligrams of potassium. This amount can significantly impact your daily potassium intake, which needs to be carefully managed when dealing with kidney issues. The good news is that while tomatoes are a common ingredient in many cuisines, there are delightful alternatives to explore. Your choice of a low potassium option may ultimately come down to your personal taste preferences. For instance, roasted red pepper sauce can serve as an excellent substitute. It offers a similarly rich and savory flavor profile, making it a delectable choice for pasta, pizzas, and a range of dishes. Furthermore, it boasts the advantage of being lower in calories compared to traditional tomato sauce. 4. Potatoes and sweet potatoes. Both regular potatoes and sweet potatoes, while popular and nutritious choices in many diets, pose unique challenges for individuals prioritizing kidney health. Regular potatoes, in particular, contain a relatively high amount of potassium, with a medium-sized baked potato delivering around 610 milligrams. Similarly, sweet potatoes, though known for their rich flavor and health benefits, also pack a substantial potassium punch, offering roughly 542 milligrams in a similarly sized serving. However, there's a practical solution to make these tubers more kidney-friendly, a process known as leaching or soaking. Research has shown that cooking potatoes, especially when submerged in cold water, can effectively reduce their potassium content. By soaking potatoes for just 5 to 10 minutes, you can achieve a potassium reduction of up to 20%, a technique often referred to as the double cook method. Nonetheless, it's crucial to exercise caution and moderation even with these potassium-lowering methods in place. Despite your best efforts, both regular and sweet potatoes will still retain some level of potassium, albeit at a diminished concentration. Therefore, meticulous monitoring of your potato consumption remains paramount, especially if you're closely managing your potassium intake due to kidney health concerns. 5. Oranges. Indeed, it appears we're starting off on a somewhat challenging note with this list. Oranges, beloved by nearly everyone, may not be the best choice for individuals with kidney concerns, particularly those mindful of their weight. The high potassium content found in citrus fruits can potentially pose a risk to the health of renal patients. Kidney disease often leads to an accumulation of potassium and other minerals in the blood, a condition that can have adverse effects on the heart. To put things in perspective, an 8-ounce serving of orange juice contains approximately 458 milligrams of potassium, while a single orange offers about 330 milligrams. For some, a solitary glass in the morning may not quite quench their thirst. Fortunately, there are alternatives to consider. Grapes, apples, cranberries, and their respective juices present themselves as excellent substitutes for oranges and orange juice. These options boast a lower potassium concentration, which proves beneficial for kidney health. This adjustment allows you to enjoy the refreshing taste of these fruits without overloading your potassium intake. 6. Pickles. It seems pickle jars have earned their place as a common household item. However, before fully committing to an all-pickle diet, it might be wise to consider your kidney health. For now, let's shift our focus from potassium to sodium. The recommended daily salt intake for a healthy adult falls between 1,500 to 2,300 milligrams. Have you ever wondered how much sodium is packed into a single pickle? Nearly 1,200 milligrams. That's a whopping 80% of your recommended daily allowance. Foods that undergo curing or pickling, such as pickles, processed olives, and relish, tend to receive a generous application of salt during the preservation process. This heightened sodium content can lead to various health issues, including high blood pressure and kidney stones. With these risks in mind, it's advisable to exercise caution with the pickle jar and perhaps explore other dietary options. 7. Spinach. It may come as a surprise that the very spinach Popeye relied on to gain strength could pose potential issues for individuals with kidney disease. This concern is primarily attributed to the presence of oxalates. Oxalates are a naturally occurring compound found in various foods. Notably, about 80% of kidney stones are composed of calcium oxalate. For those who have experienced kidney stones, it's advisable to limit daily oxalate intake to around 40 to 50 milligrams. Now, where does spinach fit into this picture? Well, it might be wise to exercise caution with spinach consumption, as a single serving can contain roughly 100 milligrams of oxalates. Furthermore, spinach carries a notable potassium load. The potassium content of uncooked spinach can range from 136 to 290 milligrams per cup. It's important to note that while leafy vegetables do lose some volume during cooking, their potassium content remains largely intact. As spinach is cooked, its volume significantly decreases, but the concentration of potassium in half a cup of cooked spinach ends up being significantly higher than that found in the same amount of raw spinach. This underscores the importance of considering both oxalate and potassium content when incorporating spinach into your diet, especially if you're managing kidney health. 8. Apricots. Apricots, with their enticing taste and wealth of essential nutrients like vitamin A, vitamin C, and copper, are undoubtedly a nutritious addition to any diet. However, for individuals prioritizing kidney health, particularly those concerned about potassium levels, apricots present a challenge. In a cup of fresh, sliced apricots, you'll find around 427 milligrams of potassium, which, while essential for bodily functions, can be problematic in excess for those with compromised kidney function. This concern is even more pronounced with dried apricots, where the potassium concentration is significantly higher, reaching up to 1.5 grams per ounce. Consequently, individuals on a renal diet, striving to maintain their potassium intake within a recommended daily limit of 2,000 milligrams, are advised to exercise caution with apricots, especially in their dried form. It may be prudent to limit or avoid them altogether to ensure potassium levels stay within the safe range. Consulting a healthcare professional or registered dietitian for personalized guidance is paramount in managing potassium intake and making informed dietary choices that align with your kidney health goals. 9. Whole wheat bread. Individuals with kidney conditions often find it challenging to navigate the bread aisle, unsure which type of bread is best suited for their health needs. In recent times, there's a prevailing belief that any bread is a healthier choice than plain white bread. Whole wheat bread, in particular, stands out as a contender, brimming with essential vitamins, minerals, and a higher fiber content, suggesting potential health benefits. However, it's worth noting that when it comes to kidney disease, the preference often leans towards white bread. This preference arises from the elevated levels of phosphorus and potassium found in whole wheat bread, a characteristic linked to the bran and whole grains present. To put it into perspective, a single slice of whole wheat bread can contain around 75 milligrams of phosphorus and 69 milligrams of potassium. If you're crafting a sandwich, that's a cumulative intake of 150 milligrams of phosphorus and 138 milligrams of potassium, and we haven't even added the filling yet. In contrast, a regular slice of white bread carries approximately 29 milligrams of both phosphorus and potassium. This distinction highlights the importance of considering bread choices carefully, especially for those managing kidney health. It's advisable to opt for white bread to help regulate phosphorus and potassium intake, aligning with dietary restrictions necessitated by kidney disease. These 9 foods we've explored today, avocado, bananas, tomatoes, potatoes and sweet potatoes, tomatoes, spinach, apricots, and certain types of bread, can have a significant impact on your kidney function. For those with kidney concerns, whether related to potassium, phosphorus, oxalates, or other factors, it's essential to consult with a healthcare professional or registered dietitian to create a personalized dietary plan that supports your specific needs and safeguards your kidney health. Remember, making informed food choices can make a world of difference in preserving the well-being of your kidneys and, ultimately, your overall health. Thank you for joining us today, and we wish you all the best on your journey towards a healthier life.